Parents know this all too well. The period of 6 to 11 years is an important phase in their children's lives. Dealing with a chronic disease like allergic asthma on top of it all can be a challenge. Here to talk about the importance of managing allergic asthma in children is allergist Dr. Jacqueline Eghrari-Sabet. So, doctor, what is the allergic asthma and how does it differ from other types of asthma or allergies?
So first, let's talk about what is asthma and how important it is. It affects 24 million people in the United States. And asthma is that problem where you get swelling inside of your lungs. So if you picture a tube or a straw and imagine it getting more and more swollen, and then you're trying to pull air and breathe through that straw, you'd understand why you'd start to wheeze and cough and get short of breath. That's what asthma is. Now, what allergic asthma is you put together with that, the reason why you're getting that swelling is from some sort of allergic trigger, whether that be a dog or a cat or dust mite. So put the two together, having the allergy with the asthma, and you get allergic asthma.
So how common is allergic asthma in children?
It's very common. There are 6.3 million kids that have asthma, and 80% of those kids have allergic asthma. It's the most common reason that kids will miss school is because of their asthma. So this is a real problem because when kids miss school, of course, parents end up missing work. One of the ways I like to try to explain it to kids so they can understand this allergy-asthma connection is when they get allergy up in the nose, they start to sneeze. Well, when that same process happens down in the lungs, they start to wheeze. They can see the sneezing and feel the dripping of their nose, and that same process is going to start to make them cough and wheeze in the lungs.
So what can caregivers do to help their children identify allergic triggers and reduce exposure?
So the first thing that I'll do as an allergist is help them actually identify what it is that they are allergic to. We do that with a really easy skin test. And commonly it'll show up that they're allergic to dust mites or to cat and dog. So what I'll help them to do to avoid that is for dust mites. I'll explain to them, first of all, what they are. They're ugly little buggies that are microscopic that like to feed off your dead skin cells. So if you can just stay away from where the dust mites would be feeding, then you'll decrease your amount of exposure to dust mite. One of the ways we'll do that is tell people to put a cover on your bed, because that's where a lot of skin cells are, or to use HEPA filters on your carpets, because that's where a lot of skin cells are. For the cat and the dog, we'll tell them simply, kick the dog out of the bed, kick the cat off the pillow, vacuum that area, wash the walls for the cat, and make sure if you snuggle with the animal that you really wash your hands pretty well.
And so what are some other types of treatments or options for children with allergic asthma?
So that's one of the things I'd really like to discuss today. I'm here on behalf of Novartis and Genentech to specifically talk about this medication that's available now for kids 6 and up. And the name of that medication is called Xolair, or omalizumab, and that's spelled Xolair. And that medication specifically targets the allergy that can cause this trigger in the asthma. So if people want to find out some more information about this medicine, they can go to the website, actually, of Xolair. And again, it doesn't start with a Z, it starts with an X, Xolair.com. And on that website, what they'll see is some more information, particularly some safety information about the ability to have an allergic reaction, a life-threatening allergic reaction called anaphylaxis to Xolair. They'll also see some other information about how to better care for your asthma, how to really ask those questions of your doctor to find out if this medication is correct, and how to really get a better handle on if your kid's asthma is under control. There's a really nice questionnaire that's on that website that talks about how often is your child having asthma attacks and what are those symptoms of asthma attacks, so that a parent gets a better understanding of what control looks like and if their kid is out of control to go seek the help to help them manage that disease.
Oh, this has been really informative. Thank you so much for joining us today.
You're so welcome, and I hope to encourage people to really go see an asthma specialist, an allergist, or a pulmonologist. If you've got this disease, if you're thinking that this may be your problem, is go take care of it, because there's really some very good therapies out there and ways that we can help you.
Thank you so much for that.
You're welcome.
Have a good day.